Welcome. Let's see what it is for, and how to use this medicine.
Ciprofloxacin, 500 milligrams, film-coated tablets.
We start with a general summary, and then we will add the full package leaflet.
First of all, follow the instructions prescribed by your doctor, pharmacist or nurse.
Subscribe to the channel to receive new content and find us easily. Let's get started. Ciprofloxacin is an antibiotic belonging to the fluoroquinolone family. Ciprofloxacin works by killing bacteria that cause infections. It only works with specific strains of bacteria.
Ciprofloxacin is used in adults to treat respiratory tract, recurring ear, or sinus infections, urinary tract and genital tract infections in men and women, gastro-intestinal tract and intra-abdominal infections, skin and soft tissue, bone and joint infections. To prevent infections due to the bacterium Neisseria meningitides, Anthrax inhalation exposure.
Ciprofloxacin is only used in children and adolescents under specialist medical supervision to treat lung and bronchial infections in children and adolescents suffering from cystic fibrosis, complicated urinary tract infections, including infections that have reached the kidneys, and anthrax inhalation exposure.
Antibiotics are used to treat bacterial infections and do not treat viral infections such as the flu or colds.
Do not take ciprofloxacin tablets if you are allergic reaction to ciprofloxacin, to other quinolone, or any of the other ingredients of this medicine, listed in Section 6. If you are taking tizanidine, see Section 2, Other Medicines in Ciprofloxacin Tablets.
Talk to your doctor or pharmacist before taking ciprofloxacin if you have ever had kidney problem, if you suffer from epilepsy or other neurological conditions, if you have a history of tendon problems during previous treatment with antibiotics, if you have myasthenia gravis, a type of muscle weakness, and if you have heart problems.
Tell your doctor immediately if any of the following occurs while taking these ciprofloxacin tablets. Your doctor will decide whether treatment with ciprofloxacin needs to be stopped. Tendon, muscle and joint pain in the upper and lower limbs, difficulty in walking, abnormal sensations such as pins and needles, tingling, tickling, numbness or burning, paresthesia, sensory disorders including impairment of vision, taste and smell, and hearing, depression, memory impairment, severe fatigue, and severe sleep disorders.
Tell your doctor or pharmacist if you are taking, have recently taken or might take any other medicines. Do not take ciprofloxacin together with tizanidine, because this may cause side effects such as low blood pressure and sleepiness.
It is preferable to avoid the use of ciprofloxacin during pregnancy. If you are pregnant or breastfeeding, think you may be pregnant or are planning to have a baby, ask your doctor or pharmacist for advice before taking this medicine. Do not take ciprofloxacin during breastfeeding because ciprofloxacin is excreted in breast milk and can be harmful for your child.
Ciprofloxacin tablets may make you feel less alert. Some neurological adverse events can occur. Therefore, make sure you know how you react to ciprofloxacin tablets before driving a vehicle operating machinery.
Swallow the tablets with plenty of fluid. Do not chew the tablets because they do not taste nice. Do try to take the tablets at around the same time every day. You can take the tablets at meal times or between meals. Do not take ciprofloxacin tablets with dairy products, such as milk or yogurt, or with calcium-fortified juices, because it will seriously affect the uptake.
Your doctor will explain to you exactly how many ciprofloxacin tablets you will have to take as well as how often and for how long. This will depend on the type of infection you have and how bad it is. The treatment usually lasts from 5 to 21 days, but may take longer for severe infections. Tell your doctor if you suffer from kidney problems because your dose may need to be adjusted.
Common side effects: nausea, diarrhea, joint pains and joint inflammation in children. Uncommon side effects: joint pain in adults, fungal superinfections, decreased appetite, hyperactivity or agitation, headache, dizziness, sleeping problems, or taste disorders, vomiting, abdominal pain, digestive problems, increased amounts of certain substances in the blood, transaminases or bilirubin, rash, itching, or hives, poor kidney function, pains in your muscles and bones.
Do not keep and reuse this medicine. Do not throw away via wastewater or household waste. Ask your pharmacist how to throw away medicines you no longer use. These measures will help protect the environment.
For complete information on the use, warnings and contraindications of this medicine, see the full package leaflet, coming next.
Is this video useful to you? Leave a comment and subscribe to the channel. We will be glad to hear from you. Now we will see the complete package leaflet. Ciprofloxacin, 500 mg, film-coated tablets, ciprofloxacin hydrochloride. Section 1. What ciprofloxacin tablets are and what they are used for. Ciprofloxacin tablets contain ciprofloxacin hydrochloride. Ciprofloxacin is an antibiotic belonging to the fluoroquinolone family. Ciprofloxacin works by killing bacteria that cause infections. It only works with specific strains of bacteria. Adults, ciprofloxacin is used in adults to treat the following bacterial infections. Respiratory tract infections, long-lasting or recurring ear or sinus infections, urinary tract infections, genital tract infections in men and women, gastro-intestinal tract infections and intra-abdominal infections, skin and soft tissue infections, bone and joint infections, to prevent infections due to the bacterium Neisseria meningitides, anthrax inhalation exposure. Ciprofloxacin may be used in patients with low white blood cell counts, neutropenia, who have a fever that is suspected to be due to a bacterial infection. If you have a severe infection or one that is caused by more than one type of bacterium, you may be given additional antibiotic treatment in addition to ciprofloxacin. Children and adolescents. Ciprofloxacin is only used in children and adolescents under specialist medical supervision to treat the following bacterial infections. Lung and bronchial infections in children and adolescents suffering from cystic fibrosis, complicated urinary tract infections, including infections that have reached the kidneys, pyelonephritis, anthrax inhalation exposure. Ciprofloxacin may also be used to treat other severe infections in children and adolescents when your doctor considered this necessary.
Section 2. What you need to know before you take ciprofloxacin tablets. Do not take ciprofloxacin tablets. If you are allergic reaction to ciprofloxacin, to other quinolone or any of the other ingredients of this medicine, listed in Section 6. If you are taking tizanidine, see Section 2, Other medicines in ciprofloxacin tablets. Warnings and precautions. Before taking this medicine, you should not take fluoroquinolone or quinolone antibacterial medicines, including ciprofloxacin tablets, if you have experienced any serious adverse reaction in the past when taking a quinolone or fluoroquinolone. In this situation, you should inform your doctor as soon as possible. Talk to your doctor or pharmacist before taking ciprofloxacin tablets if you have been diagnosed with an enlargement or bulge of a large blood vessel, aortic aneurysm or large vessel peripheral aneurysm. If you have experienced a previous episode of aortic dissection, a tear in the aorta wall, if you have been diagnosed with leaking heart valves, heart valve regurgitation, if you have a family history of aortic aneurysm or aortic dissection or congenital heart valve disease, or other risk factors or predisposing conditions, for example connective tissue disorders such as Marfan syndrome, or Ehlers-Danlos syndrome, Turner syndrome, Sjogren's syndrome, an inflammatory autoimmune disease, or vascular disorders such as Takayasu arteritis, giant cell arteritis, Behçet's disease, high blood pressure, or known atherosclerosis, rheumatoid arthritis, a disease of the joints or endocarditis, an infection of the heart. If you feel sudden, severe pain in your abdomen, chest or back, which can be symptoms of aortic aneurysm and dissection, go immediately to an emergency room. Your risk may be increased if you are being treated with systemic corticosteroids. If you start experiencing a rapid onset of shortness of breath, especially when you lie down flat in your bed, or you notice swelling of your ankles, feet or abdomen, or a new onset of heart palpitations, sensation of rapid or irregular heartbeat, you should inform a doctor immediately. If you have ever had kidney problem because your treatment may need to be adjusted, if you suffer from epilepsy or other neurological conditions, if you have a history of tendon problems during previous treatment with antibiotics such as ciprofloxacin, if you are diabetic because you may experience a risk of hypoglycemia with ciprofloxacin, if you have myasthenia gravis, a type of muscle weakness, because symptoms can be exacerbated, if you have heart problems, caution should be taken when using ciprofloxacin, if you were born with or have family history of a prolonged QT interval, seen on ECG, electrical recording of the heart, have salt imbalance in the blood, especially low levels of potassium or magnesium in the blood, have a very slow heart rhythm, called bradycardia. You have a weak heart failure, have a history of heart attack, myocardial infarction. You are female or elderly. Are you taking other medicines that results in abnormal ECG changes? See Section 2, Other Medicines in Ciprofloxacin. If you or a member of your family is known to have a deficiency in glucose 6-phosphate dehydrogenase, G6PD, since you may experience a risk of anemia with ciprofloxacin. For the treatment of some genital tract infections, your doctor can prescribe another antibiotic in addition to ciprofloxacin. If there is no improvement in symptoms after 3 days of treatment, please consult your doctor. While taking ciprofloxacin tablets, tell your doctor immediately if any of the following occurs while taking these ciprofloxacin tablets. Your doctor will decide whether treatment with ciprofloxacin needs to be stopped. Severe, sudden allergic reaction, an anaphylactic reaction shock, angioedema. Even with the first dose, there is a small chance that you may experience a severe allergic reaction with the following symptoms: tightness in the chest, feeling dizzy, sick or faint, or experiencing dizziness when standing up. If this happens, stop taking ciprofloxacin and contact your doctor immediately. Pain and swelling in the joints and inflammation or rupture of tendons may occur rarely. Your risk is increased if you are elderly, above 60 years of age, have received an organ transplant, have kidney problems, or if you are being treated with corticosteroids. Inflammation and ruptures of tendons may occur within the first 48 hours of treatment and even up to several months after stopping of ciprofloxacin tablets therapy. At the first sign of pain or inflammation of a tendon, for example in your ankle, wrist, elbow, shoulder or knee, stop taking ciprofloxacin tablets, contact your doctor and rest the painful area. Avoid any unnecessary exercise as this might increase the risk of a tendon rupture. You may rarely experience symptoms of nerve damage, neuropathy, such as pain, burning, tingling, numbness and or weakness, especially in the feet and legs or hands and arms. If this happens, stop taking ciprofloxacin and inform your doctor immediately in order to prevent the development of potentially irreversible condition. If you suffer from epilepsy or other neurological conditions such as cerebral ischemia or stroke, you may experience side effects associated with the central nervous system. If seizure happens, stop taking ciprofloxacin and contact your doctor immediately. You may experience symptoms of neuropathy such as pain, burning, tingling, numbness or muscle weakness. If this happens, stop taking ciprofloxacin and contact your doctor immediately. You may experience psychiatric reactions the first time you take ciprofloxacin. If you suffer from depression or psychosis, your symptoms may become worse under treatment with ciprofloxacin. In rare cases, depression or psychosis can progress to thoughts of suicide, suicide attempts, or completed suicide. If this happens, contact your doctor immediately. Hypoglycemia has been reported most often in diabetic patients, predominantly an elderly population. If this happens, contact your doctor immediately. Diarrhea may develop while you are taking antibiotics, including ciprofloxacin, or even several weeks after you have stopped taking them. If it becomes severe or persistent, or you notice that your stool contains blood or mucus, stop taking ciprofloxacin and contact your doctor immediately, as this can be life-threatening. Do not take medicines that stop or slow down bowel movements. If your eyesight becomes impaired or if your eyes seem to be otherwise affected, consult an eye specialist immediately. Your skin becomes more sensitive to sunlight or ultraviolet, UV, light when taking ciprofloxacin. Avoid exposure to strong sunlight or artificial UV light such as sunbaths. Tell the doctor or laboratory staff that you are taking ciprofloxacin if you have to provide a blood or urine sample. If you suffer from kidney problems, tell the doctor because your dose may need to be adjusted. Ciprofloxacin may cause liver damage. If you notice any symptoms such as loss of appetite, jaundice, yellowing of the skin, dark urine, itching, or tenderness of the stomach, contact your doctor immediately. Ciprofloxacin may cause a reduction in the number of white blood cells and your resistance to infection may be decreased. If you experience an infection with symptoms such as fever and serious deterioration of your general condition, or fever with local infection symptoms such as sore throat, pharynx, mouth, or urinary problems, you should see your doctor immediately. A blood test will be taken to check possible reduction of white blood cells, agranulocytosis. It is important to inform your doctor about your medicine. Prolonged, disabling and potentially irreversible serious side effects. Fluoroquinolone, quinolone antibacterial medicines, including ciprofloxacin tablets, have been associated with very rare but serious side effects, some of them being long-lasting, continuing months or years, disabling or potentially irreversible. This includes tendon, muscle and joint pain in the upper and lower limbs, difficulty in walking, abnormal sensations such as pins and needles, tingling, tickling, numbness or burning, paresthesia, sensory disorders including impairment of vision, taste and smell, and hearing, depression, memory impairment, severe fatigue, and severe sleep disorders. If you experience any of these side effects after taking ciprofloxacin tablets, contact your doctor immediately prior to continuing treatment. You and your doctor will decide on continuing the treatment considering also an antibiotic from another class. Other medicines in ciprofloxacin tablets. Tell your doctor or pharmacist if you are taking, have recently taken or might take any other medicines. Do not take ciprofloxacin together with tizanidine, because this may cause side effects such as low blood pressure and sleepiness. See Section 2. Do not take ciprofloxacin tablets. The following medicines are known to interact with ciprofloxacin in your body. Taking ciprofloxacin together with these medicines can influence the therapeutic effect of those medicines. It can also increase the probability of experiencing side effects. Tell your doctor if you are taking vitamin K antagonist, for example warfarin, azinokelmerol, fenpercalmin or fluindine or other anticoagulants, to thin the blood, probenecid, for gout, methotrexate, certain types of cancer, psoriasis, rheumatoid arthritis, theophylline, for breathing problems, tizanidine, for muscle spasticity and multiple sclerosis, olanzapine, an antipsychotic, clozapine, an antipsychotic, ropinirole, for Parkinson's disease, phenytoin, for epilepsy, metoclopramide, for nausea and vomiting, cyclosporin, for skin conditions, rheumatoid arthritis and in organ transplantation, other medicines that can alter your heart rhythm, medicines that belong to the group of arrhythmics, for example quinidine, hydroquinidine, disopyramide, amiodarone, sotalol, dofetilide, ibutylide, tricyclic antidepressants, some antimicrobials that belong to the group of macrolides, some antipsychotics, zolpidem, for sleep disorders. Ciprofloxacin may increase the levels of the following medicines in your blood: pentoxifylline, for circulatory disorders, caffeine, duloxetine, for depression, nerve damage or incontinence, lidocaine, for heart conditions or anesthetics use, sildenafil, for erectile dysfunction, agomelatine, for depression. Some medicines reduce the effect of ciprofloxacin. Tell your doctor if you take or wish to take antacids, omeprazole, mineral supplements, sucralfate, a polymeric phosphate binder, for example sevelamer or lanthanum carbonate, medicines or supplements containing calcium, magnesium, aluminium or iron. If these preparations are essential, take ciprofloxacin about 2 hours before and no sooner than 4 hours after them. Ciprofloxacin tablets with food and drink. Unless you take ciprofloxacin during meals, do not eat or drink any dairy products, such as milk or yogurt or drinks with added calcium when you take the tablets, as they may affect the absorption of the active substance. Pregnancy and breastfeeding. If you are pregnant or breastfeeding, think you may be pregnant or are planning to have a baby, ask your doctor or pharmacist for advice before taking this medicine. It is preferable to avoid the use of ciprofloxacin during pregnancy. Do not take ciprofloxacin during breastfeeding because ciprofloxacin is excreted in breast milk and can be harmful for your child. Driving and using machines. Ciprofloxacin tablets may make you feel less alert. Some neurological adverse events can occur. Therefore, make sure you know how you react to ciprofloxacin tablets before driving a vehicle operating machinery. If in doubt, talk to your doctor. Ciprofloxacin tablets contain lactose monohydrate. If you have been told by your doctor that you have an intolerance to some sugars, contact your doctor before taking this medicinal product.
Section 3. How to take ciprofloxacin tablets. Always take ciprofloxacin tablets exactly as your doctor has told you. You should check with your doctor or pharmacist if you are not sure. Your doctor will explain to you exactly how many ciprofloxacin tablets you will have to take as well as how often and for how long. This will depend on the type of infection you have and how bad it is. Tell your doctor if you suffer from kidney problems because your dose may need to be adjusted. The treatment usually lasts from 5 to 21 days, but may take longer for severe infections. Check with your doctor or pharmacist if you are not sure how many tablets to take and how to take ciprofloxacin. Swallow the tablets with plenty of fluid. Do not chew the tablets because they do not taste nice. Do try to take the tablets at around the same time every day. You can take the tablets at mealtimes or between meals. Any calcium you take as part of a meal will not seriously affect uptake. However, do not take ciprofloxacin tablets with dairy products, such as milk or yogurt, or with fortified fruit juices, for example calcium-fortified orange juice. Remember to drink plenty of fluids while you are taking ciprofloxacin tablets. If you take more ciprofloxacin tablets than you should, if you take more than the prescribed dose, get medical help immediately. If possible, take your tablets or the box with you to show the doctor. Look for the poison control helpline at your area at this link above, or in the video description. Information is also available online. If you forget to take ciprofloxacin tablets, do not take a double dose to make up for forgotten dose. Take your normal dose as soon as possible and then continue as prescribed. However, if it is almost time for your next dose, do not take the missed dose and continue as usual. Be sure to complete your course of treatment. If you stop taking ciprofloxacin tablets, it is important that you finish the course of treatment even if you begin to feel better after a few days. If you stop taking this medicine too soon, your infection may not be completely cured and the symptoms of the infection may return or get worse. If you have any further questions about the use of this medicine, ask your doctor or pharmacist.
Section 4. Possible side effects. Like all medicines, this medicine can cause side effects, although not everybody gets them. The following section contains the most serious effects that you can recognize yourself. Stop taking ciprofloxacin tablets and contact your doctor immediately in order to consider another antibiotic treatment if you notice any of the following serious side effects. Rare, may affect up to 1 in 1,000 people. Seizure. See Section 2, Warnings and Precautions. Very rare, may affect up to 1 in 10,000 people. Severe, sudden allergic reaction with symptoms such as tightness in the chest, feeling dizzy, sick or faint, or experience dizziness when standing up. Anaphylactic reaction shock. See Section 2, Warnings and Precautions. Muscle weakness, inflammation of the tendons which could lead to rupture of the tendon, particularly affecting the large tendon at the back of the ankle Achilles tendon. See Section 2, Warnings and Precautions. A serious life-threatening skin rash, usually in the form of blisters or ulcers in the mouth, throat, nose, eyes and other mucous membranes such as genitals which may progress to widespread blistering or peeling of the skin. Stevens-Johnson syndrome. Toxic epidermal necrolysis. Not known. Frequency cannot be estimated from the available data. Unusual feelings of pain, burning, tingling, numbness or muscle weakness in the extremities. Neuropathy. See Section 2, Warnings and Precautions. A medicament reaction that causes rash, fever, inflammation of internal organs, hematologic abnormalities and systemic illness. Dress. Adipocute generalized exanthematous pustulosis. Syndrome associated with impaired water excretion and low levels of sodium, SiADH. Other side effects which have been observed during treatment with ciprofloxacin are listed below by how likely they are. Common side effects may affect up to 1 to 10 people. Nausea, diarrhea, joint pains and joint inflammation in children. Uncommon side effects may affect up to 1 to 100 people. Joint pain in adults. Fungal superinfections. A high concentration of eosinophils, a type of white blood cell. Decreased appetite. Hyperactivity or agitation. Headache, dizziness, sleeping problems, or taste disorders. Vomiting, abdominal pain. Digestive problems such as stomach upset, indigestion or heartburn. Increased amounts of certain substances in the blood, transaminases or bilirubin. Rash, itching, or hives. Poor kidney function. Pains in your muscles and bones. Feeling unwell. Asthenia, or fever. Increase in blood alkaline phosphatase, a certain substance in the blood. Rare side effects may affect up to 1 in 1,000 people. Muscle pain, inflammation of the joints, increased muscle tone and cramping. Inflammation of the bowel. Colitis, linked to antibiotic use, can be fatal in very rare cases. See Section 2, Warnings and Precautions. Changes to the blood count. Leukopenia, leukocytosis, neutropenia, anemia, increased or decreased amounts of a blood clotting factor, thrombocytes, allergic reaction, swelling, edema, or rapid swelling of the skin and mucous membranes, angioedema. See Section 2, Warnings and Precautions. Increased blood sugar, hyperglycemia, decreased blood sugar, hypoglycemia. See Section 2, Warnings and Precautions. Confusion, disorientation, anxiety reactions, strange dreams, depression, potentially leading thought suicide, suicide attempts, or completed suicide. See Section 2, Warnings and Precautions, or hallucinations. Pins and needles, unusual sensitivity to stimuli of the senses, decreased scan sensitivity, tremors or giddiness, eyesight problems including double vision. See Section 2, Warnings and Precautions, tinnitus, loss of hearing, impaired hearing, rapid heartbeat, tachycardia, expansion of blood vessels, vasodilation, low blood pressure, or fainting, shortness of breath, including asthmatic symptoms, sensitivity to light. See Section 2, Warnings and Precautions, kidney failure, blood or crystals in the urine, urinary tract inflammation, fluid retention or excessive sweating, increased levels of the enzyme amylase. Very rare side effects, may affect up to 1 in 10,000 people. A special type of reduced red blood cell count, hemolytic anemia, a dangerous drop in a type of blood cells, agranulocytosis. See Sections 2 Warnings and Precautions, a drop in the number of red and white blood cells in platelets, pancytopenia, which may be fatal, and bone marrow depression, which may also be fatal, allergic reaction called serum sickness-like reaction. See Section 2, Warnings and Precautions, mental disturbances, psychotic reactions potentially leading to thoughts of suicide, suicide attempts, or completed suicide. See Section 2, Warnings and Precautions, migraine, disturbed coordination, unsteady walk, gait disturbance, disorder of sense of smell, olfactory disorders, pressure on the brain, intracranial pressure and pseudotumor cerebri, visual color distortions, inflammation of the wall of the blood vessels, vasculitis, death of liver cells, liver necrosis, very rarely leading to life-threatening liver failure. See Section 2, Warnings and Precautions, pancreatitis mole, pinpoint bleeding under the skin, petechiae, various skin eruptions or rashes, worsening of the symptoms of myasthenia gravis. See Section 2, Warnings and Precautions. Not known, frequency cannot be estimated from the available data, feeling highly excited, mania or feeling great optimism and overactivity, hypomania, abnormal fast heart rhythm, life-threatening irregular heart rhythm, alteration of the heart rhythm, called prolongation of QT interval, seen on ECG, electrical activity of the heart, influence on blood clotting, in patients treated with vitamin K antagonists such as warfarin. Very rare cases of long-lasting, up to months or years or permanent adverse medicament reactions, such as tendon inflammations, tendon rupture, joint pain, pain in the limbs, difficulty in walking, abnormal sensations such as pins and needles, tingling, tickling, burning, numbness or pain, neuropathy, depression, fatigue, sleep disorders, memory impairment, as well as impairment of hearing, vision, and taste and smell have been associated with administration of quinolone and fluoroquinolone antibiotics, in some cases irrespective of pre-existing risk factors. Cases of an enlargement and weakening of the aortic wall or tear in the aortic wall, aneurysms and dissections, which may rupture and may be fatal, and of leaking heart valves have been reported in patients receiving fluoroquinolones. See also Section 2. Reporting of side effects. If you get any side effects, talk to your doctor, pharmacist or nurse. This includes any possible side effects not listed in this leaflet. You can also report side effects directly via the yellow card scheme at www.mhra.gov.uk yellow card or search for MHRA Yellow Apple App Store. By reporting side effects you can help provide more information on the safety of this medicine.
Section 5. How to store ciprofloxacin tablets. Keep out of the sight and reach of children. Do not store above 25 degrees Celsius. Do not use ciprofloxacin tablets after the expiry date, which is marked on both the outer carton and on each blister strip of tablets. Do not throw away any medicines via wastewater or household waste. Ask your pharmacist how to throw away medicines you no longer use. These measures will help protect the environment.
Section 6. Contents of the pack and other information. What ciprofloxacin tablets contain. The active substance is ciprofloxacin hydrochloride equivalent to 500 mg ciprofloxacin. The other ingredients are sodium starch glycolate, lactose monohydrate, povidone, sodium stearyl fumarate, methyl E5 premium, polyethylene glycol, titanium dioxide. What ciprofloxacin tablets look like and contents of the pack. Ciprofloxacin 500 mg film-coated tablets are off-white, capsule-shaped, biconvex, film-coated tablets with CP500 on one side and on the other. The film-coated tablets come in packs of 10 or 20, but your doctor will prescribe as many as you need. Marketing authorization holder and manufacturer. Medreach plc, Warwick House, Plaintree Crescent, Feltham TW137HF, UK. Email, info@medreach.co.uk. This leaflet was last revised in October of 2020. End of package leaflet.
See the video description for detailed information and available website links. If you like this video, please support the creation of new content by subscribing to the channel. Thank you.